And we're recording and we're live. So welcome everyone to Activate Thursday. Thank you so much for joining us this evening. My name is Jesse Allen. I'm the Senior Vice President of Product Marketing here at LifeVantage. I need to move my camera. This background behind me is horrible, but we'll figure that out at another time. Joining me tonight, Dr. Melody Rodarte. I don't know why I say it that way, but Dr. Rodarte. From Arizona. Well, that's where you're at now, but thank you so much for being here tonight. I certainly appreciate it. How are you?
I'm good. Thank you for having me. It's wonderful to be a part of this.
Well, we certainly appreciate it. For those of you that are watching and joining us this evening, thank you for being here. Feel free throughout the entire conversation to add comments or questions in the comment field and your responses, and we will get to those and try to respond as quickly as possible. But appreciate you taking the time to spend a few of your minutes with us this evening as we talk about the focus tonight, women's healthcare. It's Women's Healthcare Month, the month of May, and this is a continuation, not a continuation, if you will, but a few weeks ago, Dr. Jessica Bueller and I were on this same platform and same topic, and we had a great conversation, and she had some great advice and some great examples of what women can do to really make themselves a priority and make their health a priority. And so in that vein, this is a continuation with a different aspect and perspective, but probably a very similar perspective is my assumption with Dr. Rodarte that has really coming a little bit of a different background. So let's talk about that a little bit about your background. Practicing physician in Arizona, in the Phoenix area, correct?
Correct.
Tell us a little your background. I know what it is, but the audience might not know a little bit of your background and the type of medicine that you practice.
Yeah, sure. Thank you. So I'm an internist, a fancy word for internal medicine. It seems to be an easier word. And so it's kind of the short term of that is an adult physician. So
I was gonna say, my wife says it's the adult doctor.
Yep,
right?
yep.
Children go to pediatricians, adults go to internists.
Yep. So, and then the family practice, if you think of back then, and even now, family practice would do peds and kind of, do some adulting, adults, a lot of adults, but usually once, you ended up with more serious problems, complex problems, they'd send you off to the internist because that's all we did was adult medicine. And internal medicine is the base of all specialties. So if they go on to become a kidney doctor, a heart doctor, a lung doctor, all of that, they have to become an internist first in their residency and then go on for their fellowship. So kids scare me. Thank God I only had 2 and I didn't mess them up. They're adults, but pediatrics and babies, I couldn't do. I love empowering adults to take control of their health. And so that's why I went into, internal medicine. And then I had a passion for weight loss and helping patients lose weight. And so I am double boarded. I have my board certifications in internal medicine and obesity medicine, and then went on to do a couple other certifications because in my opinion, I just felt like I needed to have that education in order to incorporate, that into my practice, like how people heal. So I did wound care and aesthetics and things like that because it gelled into how I believe I should treat my patients.
No, that's fantastic. And in addition to all of that, a thriving business. Before the call started, Melody and I said, okay, if I call you Melody.
Oh yeah.
It feels so informal, and I want to be respectful of you. Worked hard for that doctor title, but I sometimes get a little bit informal. Prior to the call starting, we were talking, her practice is expanding. She's adding more hours. She's hiring more additional staff. She's got all of that going on, yet still takes time to be with us tonight. Still volunteers time to serve as a member of the Scientific Advisory Board here at LifeVantage. That is a collective board of healthcare professionals and healthcare providers that help guide the product development and product strategy for us here at LifeVantage. And she serves on that board. And again, to the earlier point, it is a volunteer board. They're not paid to do that. And we're so grateful. Their influence from both the scientific side and the healthcare side, as well as their influence as because the board is made up of consultants, LifeVantage consultants. So their influence is invaluable. So thank you for that and for that service. It's greatly appreciated.
I appreciate being on the board. It's incredible. And the network of fellow people, my fellow colleagues on that, it's an honor to be on it. So not getting paid is nothing that I think twice about. It's good time.
All right. Well, we appreciate it, and we certainly wouldn't be where we are without that board and without your guidance. So thank you. Let's jump into the topic. We're going to talk, as I said earlier, a continuation of this focus around women's healthcare, and it's I love the fact that May is dedicated to this focus on women and really empowering them to take control of their health. And maybe just from your perspective, you work, I'm assuming, with a number of your patients are women, and they're coming to see you because health is an issue. What are your thoughts? The fact that there is this month dedicated to this focus, why is it such a challenge for women? I know the answer to that, or at least I think I do.
But I think just hearing another perspective, I think sometimes we forget to take care of ourselves. And I would say, especially women in their childbearing years, they put so much into raising their children that they forget about themselves. And I love that my job is to remind them not to. You think about when you get on an airplane and they go through all the safety, it's like you put your mask on and then you put the child's mask on, because if you're not breathing, you can't save your child.
Mm-hmm.
And so I think I act that way a lot with my patients, and I tell them, I need you to put your oxygen mask on first before you can keep going this route, because you're not going to be able to keep the light and on the both sides of the candle burning. So it's a passion of mine to make sure that my women patients take care of themselves. I think as a female provider, they feel comfortable telling me more than they might a male provider. And I tend to do a lot of lectures and topics to encourage them to bring up those, hey, I heard you on this webinar talk about this. Can we talk about this? I didn't know I needed to talk about it. So I think it's really important. And I thank you that, LifeVantage is doing this and bringing it to the forefront, because women need to take care of themselves. I don't want to wait till they're burnt out until they seek things. They have to put things in their life now, no matter what stage of life they are, 20, 30, 40, even the teenager. I tell my teenagers, well, I guess I said they were adults. I still think that they're young, but what are things they can do for themselves? Because we as a company are all about activation and optimizing health, and that fit into how I practice and what I believe. And that's what I want women and men too. But usually if you can get the mom of the family or, to be taking care of herself, she's dragging in some other people. And it's usually the husband to start doing some stuff for themselves.
Yeah. And I mean, at the end of the day, like, women are the foundation of our culture and our society. And if they're struggling with their health, there is a ripple effect throughout all of society. Unfortunately, that's just the reality. And they serve and dedicate. And there comes a point where they need to stop and take care of themselves a little bit. I love the fact that you mentioned, you talk about just empowering them, but across all generations. And I think I was out of town with my family last week. We have a daughter who's 17. And fortunately, my wife is very focused on healthcare and her health, and she's doing a number of things. And that example, I mean, my wife works with, it's an internist, but also a number of other healthcare professionals that they're always doing different things, and she's looking at different things. And it's really front of mind for her, and hormone therapy and a number of things. But anyways, that example has trickled down to my daughter. Right. So we're out of town on the other side of the country last week, and she's having some tests done. She needed a lipid panel done. And so I had to find a lab in South Carolina that could pull her blood and do that, because it needed to be done during a certain time of her cycle. And anyways, but anyways, that example, right? And the example of my wife has given my daughter permission to make health a priority for her. And I think, anyway, I love it. I think that's wonderful.
No, and I love that part. And this example came to mind. Like I love my daughter plays sports. Both my children played sports, and she's gone on, she plays at the collegiate level. But I love starting her freshman year. Like the girls wanted to hear from me. Like how do they become better athletes? How do they take care of their bodies? What are things that they can do so they don't, gain weight and they put muscle on? So I think we need to speak to that. And I hope the generations after us will be better than our generation about taking care of them and doing more preventative things instead of being reactive. So I think I commend, your wife pouring into your daughter and doing that. My daughter will still take pictures of labels, and my son will do this too and go like, I don't know what these ingredients are these safe to use? Or like, their dorm mates will say, so-and-so, do you need to go to see the doctor or the urgent care for this? So I think it's good for us to pour into at each generation, teaching how to prevent disease and what to do.
Yeah, for sure. And I love that the reaching out to you, the two examples that they gave. One, so they don't gain weight, but also so they put on muscle, right? They're asking questions to put on muscle. Like so often, our association with healthcare means being skinny, and that is just not the case, right? I mean, that's not the case. It's certainly being overweight's not healthy either, but there are so many things that we see in social media and online that are perceived as healthy, but they're all about just weight loss and frankly aesthetic and being skinny and certain things, but they're not necessarily healthy. Maybe anyways, we didn't really discuss it, like a number of the questions, but what are some of the big, and I don't know, maybe this isn't a good, I don't want to put you on the spot, but some of those fallacies that are out there, what are some of the fallacies that you think that at the end of the day just kind of misguide or misdirect women, but they're so prevalent and so easy to kind of fall into or maybe not understand correctly?
I think not listening to their intuition about themselves. I think that's one of the biggest fallacies, is like that their opinion or their doesn't matter. Their worry doesn't matter. When I was taught very early in med school, listen to your patient, they will lead you to the answer or the diagnosis. And so I think that I would love to encourage women to listen to their gut more and not be quiet when they're not getting the answer that they want, or going, I don't know if I need to tell this to my doctor. Or so that's really important, is that I want them to know their opinion does matter. What they think is going on with their body does matter, and help them, use that voice there. I love the second thing I talk about then is skinny is healthy. Skinny is not always healthy. In weight loss medicine, we have a term called normal weight obesity. And on TikTok and stuff, you might hear it as skinny fat. And it's because they have their percentage of body fat is actually in the unhealthy, where they might be underweight, but the amount of fat that they have on is not healthy, and where it's at is unhealthy. And so the blood work will show that they're unhealthy in that manner. So they might look on the outside like they're healthy, but on the inside they're not. So that's, I think, another fallacy, that skinny is healthy. It's definitely not in all cases. And if we go back to something else, a lot of women go, oh, if I put muscle on, I'm going to bulk up. Unless you're doing something you're not supposed to be doing, you can get toned, but you're not going to become this like Arnold Schwarzenegger looking female. Muscle is so healthy. It's going to keep us, it slows down our aging process. It helps our bones, our structure, how our body functions. So I wish women wouldn't be afraid of putting muscle on or lifting weights. And when I talk to them about lifting weights, I'm not saying you got to go do, these huge dumbbells. I'm like, 3 pounds, 5 pounds can make huge differences by specific types of exercise that they do. So think those are the biggest ones that I try to quickly, when you become my patient, or if you're my friend, I talk a lot about, because I'll just kind of go back to one little thing. I love my practice now that I've had for the last 3 years, because I can sit with a patient for over 30 minutes. And I think that's why women will then open up more, is they don't see their provider looking at their watch going, oh, I got 5 minutes with them. I'm only going to talk about my ear infection, or that I need a prescription to go get my mammogram or something. It's like, okay, no, there's time to put together the story, to figure things out, to go deeper. So that's where I really want to encourage people, not just women. They need to put the story together with their provider so that they can figure out what's going on. And that their opinion and what their gut is saying is important.
Yeah, I love that. I think like because I mean, the mystery can be put together, the puzzle pieces can be put together, but you have to be willing to talk about it, and you have to be willing to share what's going on and what you think, because what you're observing, your own, right? Be aware of your body. What you're observing may feel like it's not a big deal, or that it's irrelevant, but it's part of the bigger picture that physician can then help put all those pieces together. And I've seen that over and over and over again. So I think that counsel is invaluable. Listen to your intuition, and then be willing to talk about it. When somebody's watching tonight and they're saying, okay, this is great, I need help, right? I would like some help. Who or what should they be looking for from like a healthcare provider? Like who ideally should they be looking for?
I'm big into prevention.
Unless
So,
if they're in the Phoenix area, just look up Dr. Rodarte. But if they're not, what should they look for?
I think they should, I still believe in word of mouth. It's so wonderful to kind of, with Facebook and all these others, just like, in the community you're in, it's like, who loves their doctor? That's the simplest thing to do. And the other is, like, if someone's really wanting to lose weight, my board certification and my association is through the American Obesity Association. And so they can go on there and put their zip code in and find that. I do hormone replacement, same thing. They can put their zip code in. Functional medicine, personalized medicine. So I think those are some of the key terms. Integrative medicine. If they're wanting more of what I'm talking about and we're discussing, that's a way for them to find a practitioner that is more than just your typical experience that you're used to.
Yeah.
And it's definitely a growing, what's the word I'm thinking of here? I think it's more people are looking for what I'm offering and what we're talking about, because they do want to be more active in their healthcare, and how they grow old,
Yeah. Yeah. And there are so many resources today you're talking about. I mean, there are so many podcasts out there today that are just that are gold. And I don't know if you've got specific podcasts that you would recommend or that you like, but there's some that are just wonderful, wonderful resources. You mentioned functional medicine. Would you classify the type of your practice as functional medicine?
In a sense, yes. Do I have their certification? No, but I've done a lot of hours with them for the past 6 years. I've gone to their conferences. So, yes.
So give us the definition then. What is, by definition, what is functional medicine?
So it's looking at you, all aspects, like what you eat, where you live, what your exposures have been. Like when we talk about spending more time, diving into it, we understand that how many concussions you've had and where you work. And if you're sleeping, can tell us more about how your brain is functioning, and are you at risk for memory loss? So they're going to look at you in a more functional light, like really what's going on. Because
Holistic.
holistically, a perfect example is and I don't love this example, but I think people will connect with it. When someone is diagnosed with cancer, the oncologist will always say, eat whatever you want right now, just get food into you. And and a functional provider is going to say, no, don't eat whatever you want to eat. We got you, like, food is nutrition, food is medicine. What you eat right now can really either harm you or help you during chemo, after surgery, before surgery, and all of those. So that's an extreme, but how about we don't wait till cancer to figure out what to eat,
Yeah.
But a functional provider is going to really look at holistically at you and use a lot of, not always go to medicine first.
Yeah.
So, they might look at things that you can do before medicine is added. That's definitely, and your lifestyle. We really push lifestyle. How's your sleep? How's your exercise? How's your stress level? Do you meditate? All of that? Where do you work? How do you, do you bring your work home? There's so many aspects and questions that we ask in that appointment and part of your treatment plan.
Yeah, and I ask because my opinion is that what we're trying to do at LifeVantage and what we talk about from a product standpoint, but from a lifestyle standpoint, very much aligns with the approach of functional medicine. I think our concept of activation and activating the body's natural processes to heal and just allow the body to do what it intended to do very much aligns with the philosophy of functional medicine. And so
100% with that, because I think functional medicine providers know the body can heal. What are the tools that we need to use? And I love the term activation. I love that we are an activated company, an activation company, because that's what we are promoting, is allowing the body to function like it was made to function, supporting the cell structure and function. And most recently with our AM/PM, with having, actually a good multivitamin with adaptogens. I mean, that's at the heart of it, right? So many people I deal with weight. I mean, they don't even have good nutrition. So they are low in their minerals and their vitamins. And once we can actually get those in, they start to feel better because their cell has the tool to use.
isn't that so interesting, right? A product that, and not to diminish the product, but at the end of the day, it is a multivitamin, but the intelligent approach of how it was formulated, the materials that are used, and then delivering the materials that your body needs in the morning versus the materials that your body needs in the evening to align with your body's natural rhythm and that circadian rhythm. Simply by taking that approach, the response that we get over and over again from those that are using the product, I sleep so much better. I wake up with more energy and I'm ready to go throughout my day. And there's nothing inherent in those formulas that should put you to sleep or wake you up and give you energy in the morning. But by giving the body what it needs so the body can do what it's intended to do, it just works. And I think, I appreciate you bringing that up. Not that I want to plug somebody else, but I'm going to, just because I find his content remarkable. Dr. Mark Hyman, functional medicine specialist, and his podcast, The Doctor's Pharmacy, is just a wealth of information. So if you're looking for something to listen to, that's a wonderful option.
And if that feels like it's a little too much for you, because I love his, it's one of the ones that I have saved to see what comes on every week. His business partner, the Drew Perot, they used to call his podcast a little bit different, but it's definitely more for the lay person.
Oh.
And that one is actually really good as well, with some great ideas. And it's that functional medicine side, and the topics are wonderful. But I totally agree. Like, those are two that are easy. If you've never heard of functional medicine or what you can do to help with your lifestyle, those two podcasts are super easy to start listening to and just kind of get some ideas.
Yeah. Tell me that second one again.
Drew, and it's, I think, DHRU, and is his first name. And then Perot, it's like PURHOIT. I think that's how you spell it. But he and Dr. Mark Hyman are like, they both, like, they own those podcasts and do them together.
Okay. All right. I'll have to look him up. I'm not familiar with that one. I'm a big kind of a fan of Dr. Hyman, and so I listen to all his stuff and read his books, but I'll have to listen to this other one. That's great. Let's talk about that just in the next couple of minutes, and then we can wrap this up. Just maybe some good advice. You work with a ton of women, both in your practice as well as a consultant for LifeVantage, and you're exposed to so many just challenges that women face. And I think, I mean, I recognize that a lot of your patients will open up to you things that they're dealing with, and we certainly don't want to talk about that or an individual patient, but just some of the things that you see, and just some good advice that you're sharing with the majority of your patients and customers that you work with that would be beneficial for the audience tonight.
Yeah, I think everyone should know their numbers. So they should get their blood work done because it's so important to know what your vitamin D level is. Are you absorbing your B vitamins? You know, what's your cholesterol? There are so many things that you can do naturally, lifestyle wise, by just knowing your numbers and following them. Because the neatest part is when you start to implement you know, some of these key items, and then you repeat your numbers and you see that, you know, you're making a headway, and it's just by lifestyle changes or activating your cells. That's the neatest part especially for me, because a lot of times they'll be like, I don't want a medication. You just showed me my cholesterol panel. I'm like, these are things that we can do, and let's not go on a medication just yet. Let's see what we can do with your body and activating your body.
Okay, so I love that. Know your numbers. Now, just to make this really simple for some of the audience, that if they've never done a blood panel, they're going to call up their physician. So you guys that are watching, you're going to call your physician. What are they asking for specifically? Like, give them the words that they need to say to their physician so that there's no confusion.
They would want a broad lab panel. So they're going to have to get specific, because unfortunately in your typical practice, they might get a CBC, which looks for anemia. Great, still really good. Look at your white blood cells, your bone marrow. It's kind of a snapshot of your bone marrow. A CMP, it's a metabolic panel. Let's see what your kidneys are doing. What are your electrolytes? What's your fasting blood sugar? What does your liver look like? So that's that little panel. Most doctors will get those when you ask for it. That they won't even bat an eye on those. You might ask for a thyroid. When you ask for a thyroid panel, say you want an extended thyroid panel, because a TSH is one small piece of the thyroid. It does not give us enough information about what the thyroid function is. You want to know what your active forms of thyroid are. Cholesterol, we just kind of brought up cholesterol. And I talk a lot about this with my patients, especially if there's cardiovascular disease in their family. A basic lipid panel is not enough. It's like just getting a TSH for the thyroid. A basic lipid panel barely gives enough. So you can do an extended heart panel. And if your physician doesn't know about it, you know, the most typical name is the Cleveland heart panel. They can say, can I have a Cleveland heart panel or a Boston heart panel? They should be able to find on any SonarQuest, LabCorp, those types of things, because it tells us, it breaks down the molecules of cholesterol and really gives us a better number. Maybe a fasting insulin. So they usually will only think about that when you're thinking of diabetes. Well, we want to know what your fasting insulin is before you're a diabetic. Like, so we can say, hey, there's you can't pass go right now. Like, we need to take care of this and talk about this. If in a few years, you're going to become a diabetic. So an A1C is what they typically look like, look for diabetes, but there's actually goes hand in hand with the fasting insulin. So those two numbers together can really help see, are you a pre-diabetic or do you have insulin resistance? A lot of women, when they lose muscle, when they're stressed, their A1C might be normal and their regular doctor will poo-poo it, but we'll get a fasting insulin and it's 15, 20, 25. And I'm like, we got to fix this. Like, we really have to fix this. You're not allowed to have your glass of wine at night right now. A vitamin D, we talked about that. Vitamin D level, Dr. Hyman is all over vitamin D. Ask for vitamin D. They might not want you to get it until you have osteoporosis. And I'll say, like, no, we want to know that number now. I think my light went off in my motion detector here. Um, um, and B vitamins, what else? And inflammatory markers. If you're
Mhm.
undergoing a lot of inflammation, there are simple inflammatory markers like a sed rate or a CRP. If you've had the horrible virus in the past few years a couple times, I like getting a cardiac CRP on those patients and seeing if their heart was affected, because there
Yeah.
are so many things naturally that we can do to help recovery. So I think those are some of the most basic ones.
Yeah, that's fantastic. And for those that are watching, I'll get a list of all of these, and we'll post them or publish them in the comment section, so that if you didn't catch all of them, I am grateful to say everything that you listed so far is included in the panel that I do every 6 months, and then we compare them. And fortunately, I have a physician. She sits down with me and we spend an hour together and we review the panel, and she like, okay, I've got a concern here and I've got a concern here, and these three numbers tell me that you're dehydrated, right? That, like, she'll, right? But it's fantastic because then I know what actions I need to take based on those that don't involve medicine, right? Just
Yep.
lifestyle activities. Okay, know your numbers. That's number one, and I love that one. That one's fantastic. Second,
Know your nutrition.
okay,
So not all food is the same. So know your nutrition. Some people might need carbohydrates. Some people may not need carbohydrates as much. So, what vegetables, so, to eat. So listen to your body, keep a food journal. If every time you eat such and such, you get bloated, even though it might be healthy, like a Brussels sprout, it's not something for you. So know your nutrition and your eating windows. Some people do great with fasting, intermittent fasting, some don't. So know your nutrition, because that's going to help your body heal and function by knowing what food and fuel it needs to
yeah.
function. Yeah.
And if someone wanted some more personalized guidance with that, who should they look for?
So there are functional nutritionists now. So if you looked up functional nutrition in your area, they may really help. And then a functional physician, like I do food panels to look for what people might have allergies, quote unquote allergies. So it's not your typical anaphylaxis type of allergy where you eat something and now you need an EpiPen, your throat's closing off. It's more of what I was talking about. You're bloated, you get a runny nose every time you eat something, your joints hurt. So kind of looking at what's inflammatory to the gut. And I'll even say to that, then know your gut health. So what you eat will help. Knowing is important to know what food is healthy to you. But there are certain things like kefir and foods that are garlic and onions and things that have prebiotic fibers and prebiotic tendencies, that it's very healing to the body. So knowing your foods is really important, and knowing your nutrition.
Yeah, that's great. And that my wife is actually a functional nutritionist, so I feel
Oh, there you go.
I feel very fortunate.
Because let's say you had a doctor that said, hey, I need you to do the FODMAP diet. And you're like, I don't even know what that stands for. What do I do? So having a functional nutritionist, they're literally going to help you put together, like, this is what your week's worth of food looks like. This is what we're going to do right now. They really walk you through it and help you. So I've got several that I refer to, because it's not my expertise to put together a meal plan. I can tell you what foods you can and can't avoid, but yeah, a functional nutritionist is and they're a health coach too. So they're even better at really helping you implement it all.
Yeah. For those that are watching, if you want contact information, just put it in the comments, and then I'll gather if it's okay, Melody, I'll gather some contact information from you, and I can push that out to those that are watching that want specific contact information. I've got three now, because you said know your numbers, know your nutrition, and then we added know your gut health. I think that's a third one. I think that is, in my opinion, you can agree or disagree, is separate from nutrition, related, but
Yeah.
separate.
Yeah.
Like, at the end of the day, a healthy gut, it makes dividends throughout every aspect of your body. Anything else? Good. These are great. There's one
I
other
would
thing
say
with those?
log your sleep. So many people forget about their sleep and they think they'll catch up later, or they'll just know your sleep. Because if this is to everybody watching, if you're taking Benadryl in the form of NyQuil or Tylenol PM or Advil PM to get to sleep, you're doing your body a disservice. Let's figure out what's going on. Know your sleep, because sleep is when you recover, when your body recovers. You have to have adequate sleep. So if you're not sleeping well, let's talk. And a lot of times, if we can reduce our oxidative stress, we can sleep better. I'll throw that out there.
It's that one's massive, isn't it? Like, and the implications, or the health implications that come from just not getting good sleep or adequate sleep. Anyways, I was listening to an interview with Elon Musk yesterday. Obviously, everyone knows who Elon Musk is, and the fact that he's a workaholic. But he did mention that he gets at least 6 hours of sleep. But he made the comment that, I don't want to prolong this. He made the comment that when he gets less than 6 hours of sleep, he said the brain pain is real. And I just thought that was such an interesting way to say it. But that's true, right? Like,
Oh yeah.
it's not just cognitive, although it is cognitive. When you're not sleeping well, you just don't think well. But everything else in the system is just slowing and just kind of working through sand, frankly, when you're not getting enough sleep.
Yeah. Yeah.
Anything else?
I think those are good. Well, and exercise, move your body.
And exercise. Yep.
I could keep going. Move your
And-
body, figure out something that you love. If you don't love to go to the gym, there's so many other things. Like, you don't have to go to the gym.
Yeah.
That's so important.
Yeah, I think I love that, like that last piece of advice, that just find something that you enjoy. If you don't enjoy it, you're not going to do it. But find a form of exercise that gets the body out, allows you to move, puts some resistance on the muscles, takes you through a full range of motion, stretches you a little bit. Find that, and then be consistent at it.
Yep.
It makes all the difference.
And don't put a sugary beverage in your mouth after you exercise. Let's go back to number 2. Know your nutrition.
Yeah, the exercise is the reward. You don't need to reward yourself and destroy everything that you just did.
Yep.
Yeah. Well, this is fantastic. Is there anything that I didn't ask that I should have asked?
No, I can't think of it right now. This was wonderful. I hope people have some ideas of what to do to get on track and to optimize their health.
Yeah, you gave such great recommendations. And like I said, those of you that are interested in more information about the blood panel, maybe some contact information on nutritionists or functional nutritionists that would help, and different ways to log your sleep, just put it in the comment and we'll make sure to get you the information. Super helpful. I won't tell the audience what's going on soon, other than congratulations on your 25th anniversary that she is celebrating shortly with her wonderful husband, and they're going to sneak away and enjoy some time together. So congratulations on that. Thank you. Amidst all of that and your growing practice, taking time to meet with us this evening and share some of your wisdom and just advice. It was wonderful, and always wonderful for me just to catch up and talk to you. So thank you.
Thank you. It was an honor and a pleasure. I love educating. So thank you for the opportunity.
Well, it was wonderful. For everybody that's watching, thank you so much for joining us this evening and spending a little bit of your time with us tonight. And again, we'll jump into the comments and respond to all of those later this evening and tomorrow morning. But thank you again for joining us. And we'll be back again in 2 weeks. And in 2 weeks, we're going to talk about Axio, because we have some new LTO flavors coming out, and we are going to talk about them and the benefits that you receive from the wonderful product that we call Axio. So we'll see you in 2 weeks. Dr. Rodarte, we'll see you when you get back. Enjoy your time, travel safe, and have a wonderful vacation with your husband.
Thank you. Thank you.
All right. Thanks, everybody. Have a good night. If I can get this turned off. Thanks, everybody. Have a good night.